Okay, good afternoon, everybody. Day 31 for me, and happy to be here with Dr. Alexander Scott and Tom McCarthy, our Executive Director of the state's COVID response, along with Secretary Pryor, who'll be available for questions today. Also with us today is, in the front row, is my nominee for Lieutenant Governor, Sabina Matos. So I wanted to make sure that everybody was familiar with the fact that we're going to make sure that the new Lieutenant Governor is up to speed on everything that's going on relative to COVID and other related matters. So Sabina is stepping into this role in time of unprecedented challenges for our state, and I want Rhode Islanders to know that she will be a crucial partner in our COVID-19 response and our effort to get shots in arms as quickly as possible in our path to an economic recovery, along with reopening our schools from this pandemic. We have a couple updates today. Tomorrow morning we'll be releasing roughly 12,000 vaccine appointments. In total, we'll have an additional 25,000 doses available for distribution next week. 12,000 will be opened up for appointments tomorrow at 5 p.m. Happily to report that the New York Times continues to report on our progress. We rank in the top 10 of percentages of vaccines administered in the country, and we'll continue to work to make sure that we are doing everything we can to get shots in the arms, and the results will speak for themselves. There are fewer tests being done compared to previous months, but that's because of vaccinations. We still are outpacing other states on testing, and we want to continue to do that, and we encourage the people of the state of Rhode Island to get tested regularly as we try to restore and get back into our economic opportunities that we want to open up. So keep getting tested, especially as you're coming back from a spring break or a trip of any kind. Continuing to get tested frequently helps us catch positive cases early. It's especially important to be able to do this with the presence of the variants in our communities, and Dr. Alexander Scott will be talking about those issues very shortly. We're also on track to expand vaccinations to the next age group. Rhode Islanders from 50 and over, 50 to 59, will be eligible to register for a vaccine on Monday, April 5th. There are more vaccine sites ready to open in Westerly, Johnston, and East Providence next week. Tom will have more details on that in his comments. The number of vaccines coming into Rhode Island continues to increase. More supplies allows us to expand vaccination efforts. 10% and up to 16% of the doses each week will be set aside for high-risk population, including members of the communities of the BIPOC community or the communities of color. I mentioned that last week, that they're trailing in terms of the percentage of vaccinations, and so we're intentionally making sure that there's a catch-up there, as we would with any community in the state of Rhode Island. A reminder, if you haven't yet signed up for the state's vaccine interest notification system, to be notified when an appointment becomes available to you, visit portal ri.gov to sign up. And I just actually had a text before I got on stage. People was wondering whether there was a place where they could pre-register and then be notified when an appointment becomes available. That's at portal.ri.gov. We're also making strides in vaccinating our most vulnerable populations, from homebound individuals to people experiencing homelessness. Tom will talk more about those strategies and will be available to questions to talk about those specific reach-outs to these populations. Almost 230,000 people have been fully vaccinated in Rhode Island, and we've administered more than 500,000 doses in the last 3 months. This is good momentum, and we're going to keep it going. Addressing some of the concerns that have been brought up, there are a lot of mixed messages out there about how safe it is to move ahead with reopening measures. And there are concerns about the COVID-19 variant B.1.1.7. Based on what we're seeing, we are estimating that 40% or more of current cases are due to this variant. And so we're talking about this incremental flexibility on our reopening the economy. We're going to continue to take close looks on what's happening into both the infection rates, hospitalization rates, and God forbid, any other death rates that could happen in the state of Rhode Island. But it's still a serious matter. So my message to the people in the state: stay disciplined, especially coming off the holiday seasons, the holy seasons that we're currently in, and will be celebrating. Many will be celebrating Easter this weekend. So we're going to keep on this incremental approach, and we're going to make sure that we're opening up at a pace that we can absorb it from a safety point of view. And we're going to, just other states have taken a more aggressive point of view, and if you look at some of the states that have taken that 100% opening strategy, they are now tracking back. We're not tracking back, but we're not going to get ahead of ourselves, so we put ourselves in that position. So we're still limiting the size of social gatherings in Rhode Island, and we will continue to closely monitor our public safety numbers and our vaccination progress throughout the reopening process. We did see increases in cases from 10 to 14 years old, and there are a few reasons that we are seeing that. Many are occurring outside of the structured school settings, but we're definitely focused on that because we want to see a reopening of our schools before the end of the school year, because it's important for us, for the students. So we're going to take a real close look on that to make sure that that doesn't get in the way. The Commissioner of Education will be here next week with a more detailed strategy of what's going to happen after the April break. So let's continue to be disciplined, wear a mask, keep our distance, wash your hands, get tested, plan activities outside versus indoors. We've got a really great team analyzing every piece of this puzzle to make sure we're making decisions that keep Rhode Island safe and that allow for a safe, responsible reopening of the economy. Some of the school updates that I can just give you in generally, and like more specifically, the Commissioner, I just spoke to the Commissioner and asked her to be here with us next week and going onwards on the stage here so that we can keep everybody abreast of what's happening in the schools. Good news is that more than 89% of our teachers and school staff are now vaccinated. Students will continue to follow strict protocols, everyone wearing masks, and we have HEPA filters making sure that the air will be clean as we reopen our schools fully. So starting April 26th, we're continuing our reopening efforts. Schools will be able to space students 3 feet instead of 6 feet apart. This was already happening in elementary schools in the state, and settings with cause for very little concern, if any. This school update does not mean that the definition of a close contact for contact tracing has changed. Bus capacity is increasing to 75%, and cafeteria usage will be expanded, and we'll continue to keep the safe protocols in place to make sure that we are keeping everybody safe. In addition, child care providers will resume 100% capacity in their school-age classrooms effective April 26th. This will bring all child care centers back to pre-COVID capacity numbers across all age categories. And as a reminder to all our child care facilities, there are still grants available for child care providers between $3,000 and $50,000. We're really encouraging anybody that's associated with a child care to make sure we take advantage of getting those dollars out into our system, and they can apply at kids.ri.gov. Finally, if you're hosting a large-scale event planners should submit their plans to the Department of Business Regulation as soon as possible, dbr.ri.gov, and we've had many calls about what's going to happen on July 4th. Hopefully we'll have some really good information next week, but the point is, if you have a parade or you have a function on July 4th, as you get in there, let's make sure we contact Department of Business Regulation so that we can go through the protocols with you as they currently exist, and we'll certainly be flexible as we get more people vaccinated. So please don't put off making an appointment if you're eligible. It's a race to vaccinate against the new variants and into the summer months. And I hope you folks are extra careful this weekend with Passover ending and Easter Sunday around the corner, and we do all the things we know to keep people safe. Please get vaccinated. Keep a neighbor safe by helping them get vaccinated. wear a high-quality mask, and keep your distance.